Yeah, that's fine with me.
Okay.
I think the big thing is people watching.
Yep. All right. It looks like we are now live streaming. Thank you, Madam Chair.
All right, fantastic. Well, members, I'll call the meeting to order of the topic selection subcommittee of the, oh brother, my little gizmo flipped on me. Today, and this is, as we call it, round two. And for everybody to know, we are selecting as we go. We've narrowed the choice down, and we're going to narrow some more. And then after that, it gets narrowed again through the votes of the entire legislature. So this is a very special process that the legislators highly value and very useful. So this is the process in this subcommittee. So we appreciate that very much. And I thought, members, though, we would start off today by having Ms. Randall. To make sure that you all have, there's a grid with a list on one piece of paper. There it is. So do you all have that? That's what we'll be using right now. Senator Klein, you look like you might, it was in your calendar. I found out, if you want to find it there. Okay.
And I have it, also, and I'm just pulling it up, Madam Chair. Thank you.
Okay, all right. And then the other one is the ones that look like this. Also, okay. All right, then I think we got it. All right, Ms. Randall, I think we are ready for you to go ahead and take us through the grid.
Thank you, Madam Chair and members. For the record, my name is Judy Randall. I'm the Deputy Legislative Auditor for OLA's Program Evaluation Division. Nice to see you all this morning. Thanks for making the time for this. I'm going to quickly just remind you what the criteria are, the topic selection criteria are. The background papers staff provided or prepared for each topic really just kind of lay out how that proposed topic lays out against the topic selection criteria. So just real quickly, I know we did this last meeting, but just a reminder, state resources, how much state money is involved. That's pretty self-explanatory. State control, does the state control the program? We do have a couple of topics on this list where there's some federal control. So what's the balance there? Would an evaluation that we do make a difference? You know, could actions the legislature take make a difference? If it's a federally controlled or a fully locally controlled program, state control may be lower. Impact, does this affect a lot of people broadly, kind of like the trunk highway one affects everybody because it's roads, or does it affect a smaller number of people, but does it affect them deeply? So kind of thinking about those aspects. Timeliness, is it a good time to do a program evaluation? Some topics ranked higher on this just because there's a lot of interest right now. Most of the topics you'll see when you look down that column are medium, which means it's neither good nor bad. It's a fine time to do it, but there's nothing really pressing to do it now, and there's no reason to not do it now. Feasibility is one I'd really like to talk about today as we go through. And I know we talked about this last time too. You know, is this something that OLA can do? Does it use our skills? Are there data that are going to be available, especially given the shortened time frame and the still hybrid world we're in? And then balance, is this would it end up being a balanced work agenda for OLA? We have two topics that are heavily overlapping related to DHS, and we have two topics that heavily overlap related to the Emergency Medical Services Regulatory Board. So thinking about that, these are decisions you may or may not make at this meeting. They may be ones that you make at the final meeting, but those are the types of things to think about as we walk through. I'll try and go pretty quickly through these background papers and kind of highlight some of the things that I think members should really think about. One thing we did differently this time is we added a row, it's the third row down on the background paper, and it's revised evaluation questions. This was an effort we're making to start to think about how to scope these topics so that we can do them in a timely way and still make sure they're valuable. Sometimes it was just a little bit of wordsmithing, sometimes they were bigger changes. And so I'll try to point that out when I think it is particularly important. So the first one is the achievement gap. And I think probably the most important thing on this related to the revised evaluation questions is really the suggestion of a revised title, because you hear the achievement gap and you think we're going to, kind of answer that huge question, and that would be, I would say, not very feasible for us. But if you look at the questions, they're really focused on the role the Department of Education has. So we would suggest Also, this is a little bit of truth in advertising on the survey. If we put a survey out to legislators and it says the achievement gap, they might be thinking they're voting for a different type of evaluation. So trying to think through all those pieces. So the proposed title, of course, up to discussion is, the Department of Education's role in addressing the achievement gap, because we think that better reflects the questions. This is a timely evaluation. As you know, there's lots of conversations kind of perennially, frankly, around the achievement gap, but there hasn't really been a look at what the Department of Education has done. It's been more focused on programs and implementation at the schools, so this would be state level oversight. I'm going to just move on, but please feel free to ask questions, or if you want different type of information from me as we go, just let me know. The next topic is the Commerce Department's Real Estate and Insurance Enforcement Divisions, excuse me. Again, we suggest changing the title to really just focus on the oversight of insurance fraud. As we dug deeper into this and talked to the folks requesting, it seemed like actually there wasn't really a real estate enforcement division. It really is about insurance enforcement. So we suggest, again, a little more truth in advertising on this topic. We have not looked at the Department of Commerce directly in quite a long time. They've been adjacent to some topics we've looked at, and so maybe we've talked with them, but we haven't really done a program evaluation focused on the Department of Commerce in quite a while. And as you can see, last evaluated insurance regulation by Commerce in 1986. So it's been a long time. There's not a ton of state resources, but it is an area where there's a lot of control, and related to fraud, you kind of don't know what you don't know, and so seeing how effective they are at identifying and uncovering that could be useful.
Madam Chair.
Senator Klein.
Madam Chair and Ms. Randall, thank you. And just to clarify as we go through the list, are these, Ms. Randall, in any way a ranking of the preference of the auditor's office, or are they just simply a listing?
Ms. Randall.
Thank you, Madam Chair. Senator Klein, thank you for that question. They are not a ranking. They are simply in alphabetical order at this time. Achievement gap was first, even though it's so maybe that threw you off on the alpha, but it's just alpha order. We do provide a ranking at our next meeting where we kind of rank the final 10 from what we think would be the most valuable, most promising to the least. But at this point, they're not in any meaningful order other than alphabetical.
Madam Chair.
Representative Liebling.
Thank you, Madam Chair. I have a similar kind of process question here. And I'm glad Ms. Randall mentioned the revised evaluation questions, because I was just wondering, so if we were to select these, the revised evaluation question, can we kind of assume that the revised question would be what would be how the thing would be framed? That is pretty important in selecting what exactly would be looked at and how it would be looked at. And I realize that when you put these together, this isn't the final, because there's always a question about scoping and, we bring in all that other information. But as we talk about these, how should we look at the revised evaluation as opposed to the original evaluation questions?
Well, Representative Liebling, it's, as Ms. Randall has said, it's really subject to us as the topic selection committee to really weigh in on that. If we like the revised evaluation question, then that's a choice we can make to say, I so appreciate it, by the way. I think it really steps us forward a bit in our selection process to have that kind of work, and I really appreciate it. But it's up to us in part. If we like it, yeah. If we like the original, that's a decision. But we always take a lot of input from Ms. Randall, Mr. Nobles. I hope that answers you.
Yeah, well, Madam Chair, then I guess the question is more for you. Before we narrow these down, can we kind of discuss that and have an agreement on it so that we know what we're talking about as we make our selections? That would be very helpful.
Thank you, Representative Liebling. I would say that as we go through these, we're going through them right now, from top to bottom on the alphabetical list we have here. When you're doing that, just put down your mark. Yep, you like the revised question. So if we end up at the end that everybody likes the revised questions and there's kind of a general consensus for that to whatever we choose in the end, then that's what we'll do. But I think until we hear them all, I couldn't preemptively, I need to hear.
Oh, well, Madam Chair, I'm not asking preemptively. I'm just saying before we start actually selecting, I'd
Okay,
like us to just make sure that we're all on the same page about what this would be. So are we kind of accepting the revised or not? That would be
Okay.
really helpful so that we're all on the same page. Thank
sure.
you.
Yep, and you keep track of that, and then as Ms. Randall finishes going through before actual selecting, then we'll have that discussion. All right, thank you. Thank you for asking. It was a good question. Ms. Randall?
Thank you, Madam Chair. So the next topic is the DHS direct care and treatment topic. This is the first of 2 DHS topics, and this may be something members want to think about as you're making the selection for the final 10 today. You know, from a balance perspective, I think it'd be unlikely that we would do both the DHS direct care and treatment topic and the discharges from Minnesota Security Hospital. They both heavily focus on the security hospital. Whether members want to make a decision at this point on which, you know, one to put forward or wait until you see feedback from the survey, that's something just to think about kind of as we're looking towards the end goal here. We reframed this topic a little bit to focus on the largest facilities that DHS runs, the state hospital, the sex offender program up in Moose Lake, and then the Anoka Metro Regional Treatment Center. We think that would at least help us as focus and be a little bit more meaningful. We would note that there's a lot of legislative interest in this topic, at least from the early stages. Of course, there are a lot of state resources, and it's timely because of the interest. I would note feasibility here is medium because some of the questions are going to be tricky, and we're going to need probably some further scoping decisions if this topic gets selected. You know, assessing the right number of staff in a facility. Well, you know, we like to have criteria. It's not just what we think is right. And so finding kind of standards for that might be tricky. Doable, but, you know, it's just an extra challenge on that topic. The next DHS topic is the discharges from the Minnesota Security Hospital. In this set of revised evaluation questions, it got expanded a little, which is kind of contrary to what we were trying to do, but that's because there were kind of 2 different sets of interests related to this topic. It kind of came to us first from some citizens who were concerned about the review board and how discharges happen. And then during the selection process at the last meeting, there was interest in kind of what happened post-discharge. And so this got broadened to look at really the whole discharge process. And if we're looking at how residents do post-discharge, that might be it might be a little tricky from a feasibility standpoint in terms of how we get that data. You know, we just have to do a little bit more thinking about how we figure that out. Moving on, the next topic is election software. And this one, I want to just point out on the feasibility is medium low. To figure out whether the equipment accessed the internet inappropriately, so during certain times when it's not allowed to access the internet, whether that happened would require us looking through these kind of voluminous logs of output. Again, something we can do, but we might have to do a sample. Also, if machines have been reprogrammed, because there have been elections since then, some of that information might get lost. I know I voted in an election a week or 2 ago, my local school board thing. So, so some of that information may be lost. So I'll leave it at that one. The next topic is the Emergency Medical Services Regulatory Board. As I mentioned, this is one of 2 topics that are related to the board. One thing I would note on this is that OLA is likely conducting a financial audit of EMSRB in the coming months, and they will look at some of these same questions. So as between this topic and then the medical emergency ambulance services topic, we think it might make more sense for us to do the ambulance service topic. EMSRB is, of course, a relatively small board. I will say having us come at them with both a program evaluation and a financial audit, while not unheard of, is a burden for them. We still would, of course, need information from them for the ambulance services topic, but it wouldn't necessarily be the same type of information. So it might be more complementary to do the other one. Nevertheless, EMSRB, I think, does ask some important questions, but again, I do think we might be getting at that through a financial audit. The next topic is energy grid, and I do want to make sure you're all looking at the correct version. We did have to make some changes to this. We got some additional information. The way you'll know if you're looking at the correct version is if state control is medium rather than high. And the reason that change got made is because it turns out there's a larger role than we realized from both federal regulators and regional organizations, MISO, if you know them, in terms of the transmission of energy. Despite our efforts in narrowing this, you'll see the revised evaluation question. We were trying to narrow it to reliability. Despite our efforts there, we think we would need more scoping and more direction from you. There's the electrical grid, there's the whole natural gas system. They're different, they're complex, they're technical. So at the very least, it would be helpful to have some guidance on which system you're most interested in, and then we could go from there. But the state control being medium will limit a little bit on the effectiveness of this evaluation. But again, I think with some scoping, we could probably carve out something useful here. Medical emergency ambulance services, I think I probably already touched on this one with the other one. Again, between this one and the EMSRB topic, we think this one might be less of an overlap on the financial audit. And I think an independent review here would be useful. Minnesota Housing Finance Agency. The questions here are very focused on accounting standards. So you'll see our feasibility here is low because we really think it's more of a financial audit than a program evaluation. Additionally, there's a lot of reports that are already put out related to MHFA and its finances. They're audited by an independent firm. They publish the financial report on its website annually. So while we could do this, I think there's a question on if the value we're adding is the most value we could add, and perhaps legislators may be able to get answers to their questions elsewhere. Office of the State Archaeologist. Surprise, it's a new topic that wasn't approved by the members last meeting. But there was some kind of late interest in this topic, and several members on this subcommittee expressed an interest in this topic. So we did draft up a background paper and provide information to members. I think there are some real concerns related to the Office of the State Archaeologist. It's also a narrow topic that could definitely be addressed through a special review. So while we provided this information to members, I realize it's a little bit outside the process, and it's also something that I do think would be well suited for a special review. The next topic is the Petroleum Remediation Program. The revised questions here are mostly just wordsmithing. I don't think it really changes the focus of the evaluation. OLA has not looked at this ever. We've never looked at MPCA's role. We've looked at Commerce's administration of the Petro Fund, which is related, but not looked at MPCA's oversight of this. And we think that this is useful and has broad impact on the state. The next topic is problem gambling. I think we revised the questions just a little bit. Again, I don't think in a real substantive way. One thing to think about is its overlap with the other DHS topics. It's not the same facility, the way the direct care and treatment and the discharges, those two topics are looking at the same facility, but this is another topic related to DHS. So that's something to consider when members select final topics. Different parts of DHS, and DHS is large, so it's not like doing two of EMSRB, but it's again something to think about. School nursing services. I think this is an interesting question or topic, but there are some questions related to the feasibility. One related to state control, interestingly. Of course, the legislature can establish laws that govern this, but a lot of this is, local decisions by school districts. I mean, one of the things is, the current laws at least do give the districts quite a bit of flexibility in how they provide nursing services. There are some questions related to feasibility. You know, in a year of shortened timelines, we would have to get data from individual school districts. So we'd probably do more of a sample than all school districts. And then defining what quality health services are, it would be a little bit tricky, but I think we probably could come up with some standards. But again, these are just things to think about as we go through scoping. I'll leave that one at that. And then the next topic is trunk highway funding. This is also largely financial audit questions, and the financial audit division is conducting a financial audit of the trunk highway fund. So we think this one would be better suited to the financial audit division. The next topic is unemployment insurance fraud. This one is interesting because there's a lot of concern around this right now. I think timeliness is high with all of the federal money coming in. So there's a lot of federal money. So this one I think is tricky to tease out on the different criteria, frankly, because there's a confluence of, you know, it's not high state control because there's so much federal money, but there also is a decent amount of state money, especially this year. And so you have a high timeliness factor. But then you also have additional oversight by the feds, because I think there is concern about fraud. So I think we could do something with this topic. I think the state control is questionable. But there's enough state control that we could probably find something meaningful. While state resources aren't always this high, right now they're unusually high. So again, because of the timing of it, it may be a better topic than maybe it would otherwise. But it's not without its challenges as well. And then the final topic is the use of force by State Patrol and DNR conservation officers. This is another topic where we would need some help with scoping. Right now, it's focused on State Patrol and DNR conservation officers, but there are other officers within the Department of Public Safety, for example, Alcohol and Gambling Enforcement Division. There are other folks who may be involved in this. So do we really want to limit it to State Patrol and DNR conservation officers, or do we want to expand it to other types of officers? And then there's also questions about the availability of data on the use of less lethal. And this one, we revised the questions based on the conversation that we had at our last meeting, which I know was intended to help narrow, and I appreciate that, but it also introduces some questions around data availability and how data are tracked. And then it also would require a decent amount, we think, of talking to folks in the community, which, depending on how quickly we get back to whatever new normal we're getting back to, may or may not be difficult at this point. So I kind of sped through those. I'm happy to answer questions or follow your lead, Madam Chair. Thank you.
Thank you, Ms. Randall. I think first we're going to go to the questions. Members, you can just raise your hand. We're small enough. And we're not doing selection right now. This is questions pertaining to things. Representative Hansen.
Thank you, Madam Chair. Well, I was going to move to narrow by taking the ambulance instead of the board as a recommendation, and then that would reduce one, and then have the archaeologist be a special review. So that was what I was going to recommend, but I could frame that as a question if you'd like Jeopardy. Would it be possible to remove the archaeologist and put that as a special review, and to narrow to pick the ambulance instead of the board?
Ms. Randall, would you respond to that? I would say yes. I don't think that's an issue, but I was really focused on those kinds of questions are very important, Representative Hansen. Representative Erickson, what I want to ask right now is which ones of these in regards to financial audit, because I don't want to take and put more effort into what is really should be a financial audit. So I'd like to, I think similar to what Representative Hansen is talking about, I'm kind of going in the same direction in some ways. So on the financial audit, I have down 14. There was another one, I thought.
Madam Chair, this is Representative Erickson.
Yes.
I think that there are 3 that were recommended for financial audits: the Emergency Medical Services Regulatory Board, the Minnesota
Oh, yeah.
Housing Finance Agency, and the Trunk Highway Fund. I think we should eliminate those, considering the fact that one of them is already in a financial audit process, and the other two would be very appropriate for financial audits. That
So what would
my
be, will you
recommendation.
repeat those four? And Ms. Randall, would you confirm what are the four financial audits? Or maybe Ms. Randall can just repeat it for us.
Madam Chair, members, I think Representative Erickson identified three. It was number
Oh.
six, which was the Emergency Medical Services Regulatory Board, number 9, which is Minnesota Housing Finance Agency, and number 14, which is the Trunk Highway Funding.
So when you say that, does that mean if we move them to financial audit, that then they would be done within the financial audit?
Madam Chair, number 6, the Emergency Medical Services Regulatory Board, and number 14, Trunk Highway Funding are going to be underway in the coming months. The Minnesota Housing Finance Agency is not currently being planned for a financial audit. We can certainly recommend it to them, but they also are audited by other independent organizations regularly. So whether OLA's financial audit division does it, I'm not sure is necessary, because I think the information would be out there for members already.
Okay. So does everybody concur then to move off the list of 16 then, those three named? Okay, so that would be number 6, move to financial audit, number 9, and number 14. So if members all got that marked. I think the other one that was special review is number 10. We could move that off also to number 10. I mean to special review. The other ones, how many do we have left then? So that's 3 + 1 is 4.
Madam
We have
Chair,
a total of
We have
16,
12
that leaves
left.
2.
Madam Chair.
Senator Klein.
So I wonder, since we believe that number 6 is covered by financial audits, I wonder if that means that number 8 also is sort of already scoped within that, and if that would be another one to easily move off the list, or do people not agree with that?
It wasn't mentioned as a financial audit from Ms. Randall. So maybe Ms. Randall, you could comment on Senator Klein's question.
Thank you, Madam Chair, Senator Klein. The questions under number 8, the medical emergency ambulance services, they're not financial audit questions. The issues with number 6 related to the board were kind of some governance issues and more control, and those fall under financial audit control compliance more readily.
Members, when I was also listening to Ms. Randall go over things, I have a concern about 16, the last one being difficult and large, also probably has other concerns as well that I think it might be. And I just want to make a proposal. I would be willing to give up number 5 if other members could give up number 16. And then that would leave us with 10.
I support that, Madam Chair.
Sounds like a deal.
That's why I have my hand raised. I was going to suggest that very thing. So thank you.
You know, Representative Leeling, I forgot to put up my participants. You know, the little bar on the side that shows the hands raised. That's also one reason why I said don't, because sometimes when you're doing this. Well, thank you, members. I think with that, I think we've actually, usually we choose in a different direction. This time we narrowed down to 10. It works. So Ms. Randall, would you go ahead and list the ones that are left so we all have a list? And then I know you'll also send that out to us, but just for right now.
Madam Chair, absolutely. So the remaining 10 topics are the achievement gap, Commerce Department's insurance. We're going to change the title. This maybe also might be a good time to discuss if we agree with the title changes.
Well, let's first just make the list and then
Okay.
let's go back and talk about revised scoping and other stuff.
Perfect. All right, I'll go with the titles that they currently are, Madam Chair. Thank you. The
Okay.
achievement gap, Commerce Department's real estate and insurance enforcement divisions, DHS Direct Care and Treatment, Discharges from Minnesota Security Hospital, Energy Grid, Medical Emergency Ambulance Services, Petroleum Remediation Program, Problem Gambling, School Nursing Services, and Unemployment Insurance Fraud.
Can you go through them again? I couldn't keep up with you.
Oh, I'm sorry, Madam Chair. Yes. Number 1, the achievement gap. Number 2, Commerce Department's Real Estate and Insurance Enforcement Divisions. Number 3, DHS Direct Care and Treatment. Number 4, Discharges from Minnesota Security Hospital. Number 7, Energy
Okay,
Grid.
just a minute. So 3 and 4?
Madam Chair, correct. They are both still on the list for now.
Representative Hanson didn't, or was it the ambulance one that you,
Madam Chair.
Representative Liebling?
Thank you, Madam Chair. So I was going to suggest, yeah, as we went through these, that we, even though we, we're narrowing quite a bit here, but I do think that the suggestion that the number 4 is kind of subsumed within number 3 a little bit, was a good one. And I would suggest taking number 4 off just for that reason. And, but I think that was another member's, that just would be my suggestion that we do that.
So that would give us 9 instead of 10. But that's
Madam Chair,
okay.
Madam Chair, this is Representative Erickson.
Mhm.
I
Representative
think that we leave the 10 that we decide on the list, because the information that will go to our members will be pretty specific as far as I remember, and then they'll be able to discern between 3 and 4 if there is, a decision by members to get rid of one of those or both of them. So I think we could rely on what the OLA is going to send out. So I think we keep them on the list, so we end up with 10. I think that's the most fair to our members. Thank you.
I don't think there's any, I think we can do it either way because we have 10. So no big reason to knock it off because our goal is 10. So let's just leave it on then for that reason. The next one then would be the Medical Emergency Ambulance Service. Is that right? No, Energy Grid.
So Madam Chair, after the discharges from Minnesota Security Hospital, it's number 7, Energy Grid. And then number 8, Medical Emergency Ambulance Services. Number 11, Petroleum Remediation Program. Number 12, Problem Gambling. Number 13, School Nursing Services. And then number 15, Unemployment Insurance Fraud.
Okay. Okay, and the next thing I wanted to do, we can have a motion to adopt these 10 and then continue with the discussion, I think, on whether to use the revised evaluation questions instead of the original titles, okay? Representative Hanson?
Thank you, Madam Chair. I would move the 10 remaining as identified by Ms. Randall.
Okay.
Oh,
Okay, members on that.
Madam Chair.
Representative Liebling.
Thank you, Madam Chair. I just would note, when I asked this question at the beginning, your response was, we're going to talk about this before we adopt,
Exactly.
not afterwards.
Exactly.
So I think
Representative Hanson was eager to make
Yeah.
a motion, and so then I forgot. You're exactly right. So Representative Hanson, let's just pull that back.
No problem.
All right, good.
And could I ask a question as well, Madam Chair?
Sure, Representative Liebling.
So I know that we talk about, we're supposed to narrow it to 10. I mean, is that a given that there should be 10? I mean, I just want to go back to our last meeting where, we were told quite plainly that the resources are difficult right now. And, some of the things on the list are still pretty, according to what we've been told, are still very difficult. And so I don't know if, I know that Representative Erickson, wants to give members a lot of choice here, but I don't know if that's really the right strategy for us right now, given that some of these would be quite difficult for the OLA to accomplish. And I don't know if we want to just, I don't want to restrict people's choices. On the other hand, I kind of think that's our role here, is to get more into the weeds of what is doable, feasible, and how it should be put out there, and then give members a choice among things that we really think are reasonable for them to choose, not just 10 because we want to give them 10. So could we have just a little discussion about that? Because I would be not really that comfortable just saying, here are these 10, frankly, but we
Well,
do need to talk about what they are.
After
first, too.
we'll do that, Representative Leaving, but just so you know, there are lots of times in the past where there was this discussion and we leave it to the members. We don't get overly prescriptive. We just leave it to the members. Because it's on doesn't mean it's going to be chosen. And the next level it is. So once we've narrowed down to the 10, I'm not comfortable going below that because I'm going to trust my members to, they're going to get information and they'll do fine. But let's go into a discussion of the revised evaluation questions. And Ms. Randall, if you want to just walk us through the choices following the grid, so we kind of have a sequence.
Sure. Thank you, Madam Chair. So the first topic is the achievement gap. And we did propose some revised questions. Again, I think they're mostly just reframing the existing questions. The important thing here would be to revise the title so that the title better reflects the questions. I do think when you have a survey and people just see the achievement gap, they're going to think they're voting for something quite different. So that's the suggestion for the achievement gap title.
Okay, as we go through these, members, anybody object to using the revised evaluation question as described by Ms. Randall? Just give me a thumbs up or a little something. You're all good to go?
Madam Chair, this is Representative Erickson, and I think that the
Representative
renaming,
Erickson.
that the retitling is an excellent decision that Ms. Randall has brought forth, because we do not want to deceive members into thinking that voila, we're going to solve the achievement gap because it's a topic. No, we want to look at MDE's involvement, and that was the intent in the first place when I and others brought forward this topic. So I think it's an excellent change. So I certainly support it.
Looks like it's supported by all our members, so we'll go with that, Ms. Randall.
Thank you, Madam Chair and members. The next topic on the grid, number 2, Commerce Department's Real Estate and Insurance Enforcement Divisions. Again, on this one, we don't actually suggest changing the questions, but again, we suggest changing the title so that it's focused on the oversight of insurance fraud, which is again reflective of the questions and Commerce's role.
Members, are you acceptable with that revised question? Everybody's good? Okay, thank you. We're good with that then. Go ahead, Ms. Randall.
Thank you, Madam Chair and members. The next topic, number 3, DHS Direct Care and Treatment. We do have some revised questions here to focus on the 3 largest facilities that DHS operates. Again, the State Hospital, the Sex Offender Program, Moose Lake, and the Anoka Metro Regional Treatment Center. I think the questions are largely just framed around focusing on those three facilities, but it's the same fundamental questions. We don't suggest a change in the title at this point. We could, if you wanted us to kind of get those 3 facilities in the title name as well.
I would rather avoid that, I think, members. I appreciate the option, but I think it kind of puts them out there, and I think it'd be better not to.
Madam Chair, that's perfectly fine. Are we okay with the revised questions?
Revised question, everybody? Good? All right, you're good? Okay, we're good.
Great. Thank you, Madam Chair and members. The next topic is the discharges from the Minnesota Security Hospital. And again, we did revise these questions. For the most part, they're reframing the original ones, and then we did add the question about how residents fared following discharge, reflecting the conversation at the last meeting.
Is everybody okay with the revised question? There'll be further scoping, by the way. Okay, nobody's objecting, so let's go ahead with the revised.
Thank you, Madam Chair. The next topic is the energy grid. And here we may want to pause a little bit. So we did revise the questions to focus on reliability. We do also suggest revising the title to focus on reliability. I don't know if members are prepared to make this type of decision right now, but I do think an imminent decision is whether it's focused on electrical energy or natural gas. And to the extent we can provide that information to members when they're voting on it, that could be helpful.
I think reliability has to include all of our energy sources. I don't know if reliability can be just say, is this reliable? Representative Hansen, you're muted though.
Thank you, Madam Chair. And I was wondering if the word that might be better is resiliency. My interest in this topic would be more on what happened in Texas, where with the frost and the grid went down, and that would seem to be something more than often reliability. I mean, they're similar but not the same, and that resiliency is the ability to withstand threats, I guess. I know that gas and electric are both massive, but my interest here would be, is our system as a PUC making sure that we wouldn't have a situation like what happened in Texas that we're still dealing with. And I know that dealt with both electricity and that's a little more resiliency than reliability, but that's just my 2 cents worth.
That's perfectly good. That's what we're here for. Senator Klein.
Thank you, Madam Chair. And I also thought sort of the reason for this subject was sort of recent events in Texas, and those had an impact here in Minnesota as well. And so I guess I would throw the question back to Ms. Randall. If I guess you had to scope it between electric and natural gas, do you see one of those as being more productive in terms of getting us the information we're looking for, or one of them is more scopable by your equipment and so forth?
Ms. Randall.
Madam Chair, Senator Klein, thank you for the question. I probably honestly don't know enough yet to be able to say which one would be more doable for us, whether it was natural gas or electricity. But I'm wondering if when I'm looking at the revised evaluation questions, and I'm wondering if we just go with the second question, which is, what actions has PUC taken to ensure that Minnesota is prepared for external threats to its systems of energy production, transmission, and delivery to customers? That's the external threats was weather and maybe other things. And that was kind of reflective. We added that question in because of the concerns about what happened in Texas. And so maybe rather than scope by grid, by energy type, we scope and focus on that question in particular. It's just a thought.
Representative Erickson, and then Senator Klein.
Well, Madam Chair, I was just going to concur with Ms. Randall that I think that's an excellent decision to go with that question.
We'll make the decision, but her suggestion is very well taken. Thank you.
And
Senator
Madam Chair,
Klein.
oh, I'm sorry.
Next, Senator Klein.
Similar to Representative Erickson, I was simply offering support for Ms. Randall's suggestion.
Okay, wonderful. Representative Liebling.
Thank you, Madam Chair. Just, I like the idea too. I just wanted to be really clear though, because one of these questions in here, the other question had to do with cost. And so I just wanted to be explicit and, and it does seem like it would be much more feasible if we weren't doing the cost question as well, because that could be kind of complicated. So I just wanted to be clear that that's what we would be doing here. And I do like the idea, and I like Representative Hansen's resiliency as well.
Thank you, Representative Liebling. I would weigh in and say, I think to do both, reliable and resilient, they're really tied together. Resilience needs reliable. The other thing is down in Texas and California as well, I think it has to include all sources, reminding ourselves that electricity uses natural gas. And so if you do as if they're different, natural gas, electricity, you're missing the fact that they're just a more direct way or an indirect of handling it. But I think we've got to include all the sources, renewables included, nuclear energy, because I think it's that basket when you talk about resilience and reliable, especially at this stage. I would like to see both words and then include all sources.
Madam Chair,
Mr. Nobles.
just one thought, not to muddy the waters more, but this is going to really require, I think, some additional thought and scoping on our part when we bring this back, particularly because, as you just said, there are many elements to provide, many sources that go into providing energy. Oil is one, and there's been a lot of controversy about pipelines. Coal is another. Nuclear is another. And when I think about the question of dependability, reliability, or resilience, and is PUC doing enough to ensure those, whichever word we choose, there are many dimensions to that. There's supply chains, there's security threats. So this is going to be a big topic. So we will really need to work on some scoping of this, but I think we're fine with where we're at this point, that we need to present it to the members as, in general, is this something that they are concerned about and interested in us doing an evaluation?
I think so. The revised title would be Minnesota's Energy Reliability and Resiliency. Does that sound fair? Okay, I'll go with it then. And then members, what action to ensure prepared for external threats to its systems of energy production, transmission, and delivery to customers from all sources. I think that might capture our conversation, and then the title of reliability and resiliency without going into, it allows us to have room to scope after that without doing it now. What we don't want to do is now. Okay, with that, members, are we good to go on that? I know Ms. Randall and others are taking a good, okay, we're good. Next one, Ms. Randall.
Okay, thank you, Madam Chair. The next one topic is the medical emergency ambulance services. It's number 8 on the grid. And the revised questions here are really just they're semantics. I don't think they're substantive.
Okay. With that, members, are we okay with the revised? All right, everybody's looking good. Okay, we'll go with that. Thank you.
Thank you, Madam
I
Chair.
so appreciate this. This revised question is, boy, really helpful.
Well, Madam Chair, I really appreciate that you're all willing to engage in this and think about it with us. It's really helpful for us as well. So thank you. The next topic is Petroleum Remediation Program. And again, this is just a wordsmithing. I don't think this changes the substance of the questions, the revised evaluation questions.
Everybody okay with the revised then? Nods are good? Okay. Next one, Ms. Randall.
Apparently somebody is calling the phone in my conference room, so I'm just going to ignore that, but I don't know what's happening, but I'm just going to ignore that and excuse me for that. The next topic is number 12, problem gambling. And the revised evaluation questions just expand a little bit on the original evaluation questions. Again, I don't think they're substantively different.
Okay, everybody okay with revised? Okay, all right, good. Go ahead, Ms. Randall.
Thank you, Madam Chair. The next topic, number 13, is school nursing services. And this one is simply changing the third question. Rather than saying provide adequate oversight of school districts' health services for students, it just says provide oversight. I think if this topic got chosen, we would explore the nuances of the type of oversight. It's more a definitional, what is adequate? And so rather than commit to that in this question, we just left it at oversight.
Everybody okay with the revised? Just a modification. Okay, we're good. Thank you, Ms. Randall.
Thank
Next
you,
one.
Madam Chair.
Madam Chair, may I just
Representative Liebling.
Thank you, Madam Chair. Before we move off of that one, I'm looking at
Sure.
the revised question, and it seems like it's broader than what the topic was, because it's about school districts' health services for students. And I'm actually happy with that. But I just wanted to flag that the original question was about school nurses. And the revised question is about, and in fact, the original question seems to have been more broad than actually just school nurses, perhaps. But I just wanted to flag that. I think it's a good thing, because I think part of the point here was that a lot of schools don't have school nurses, and they kind of muddle through with health services in various ways, and it would be good to know and understand that. But I just wanted to bring that up, and so maybe we would need to, I don't know if the title would need adjustment, given that we're really not talking about, I mean, its title is nursing services, but we might not really be talking about only nursing services, because that implies it's delivered by a nurse. So just want to throw that out there.
Representative Liebling, I think if you take a look at this though, it says change the third question. That means the other two questions would stay the same.
Yes.
So they're not changing the title here. Does that make a difference for you?
It probably does. Just give me one moment here.
Yeah, it's a little bit different because Ms. Randall is retaining the first two questions and just modifying the third one.
You know, it does, though, still perhaps maybe we should consider a title change. That would be my only, I appreciate that. Thank you for pointing that out, Madam Chair. That is correct.
Madam
but
Chair.
Maybe title.
Madam Chair.
Mr. Nobles?
I think Representative Liebling really raises a good point that needs maybe some additional clarification and discussion, because, you know, she's triggered in my mind the idea that, are we talking also about mental health services when we talk broadly about health? I originally thought the idea of a nurse providing services was maybe much more narrow to, you know, a student comes in with a fever, or somebody in the school cuts their finger, you know, but not mental health services. So if we're talking broadly about health services, I think one of the real issues out there with many people, and I think they'll respond to the title, that we're going to look at mental health services and not just. So I think, again, the questions need to correspond with the title. And I think that's Representative Liebling's point. So.
Well, I'm not sure when I read the questions, but again, additional comments from anybody? This seems to be your particular question. How about if we go on and we'll come back to it at the, is there anything else?
Well,
Ms.
Madam
Randall?
Chair.
Yeah, go ahead, Representative Liebling.
Well, maybe I'm just looking at this quickly. I mean, probably the staff will want to take another look at this, but I would think maybe just calling it school health services would, and then
instead of nursing.
Yes,
School.
and I don't know, I mean, to Mr. Nobles's point, I mean, mental health services are incredibly important, but I don't know if that right now, because we're doing a lot of that through school linked mental health grants, which actually engage outside providers. I don't know the extent to which bringing that in explicitly would really make this way too broad of a topic and really muddy things up. And I don't think that was really the intent here. It was, I think originally was focused on school nurses. But right now I would be happy just to change the title to school health services rather than nursing explicitly. But I'm happy to just take it and let the staff work on it a little bit to figure out how it should be presented.
It makes, thank you, Representative Liebling. Sometimes it makes it easier for them if we do a little bit of that. I don't have any problem with school health services. A question I have for you, Representative Liebling. Are you then okay with the three questions as they are presented here, or do you want the staff to do a little more?
I don't object to the questions.
Okay.
It's just really just want to make
title.
sure. Yeah.
Okay.
Thanks.
All right. Let's agree then that we'll change it to the title, School Health Services, and then leave the revised evaluation third question. And then I think if Ms. Randall, you have some wordsmithing later, I don't think we'll object to that, members, right? She does a good job. All right. All right, Ms. Randall, you can go on to the next one then.
Thank you, Madam Chair. And I'll just note my staff do a great job that's, I just get to reflect their good work.
Okay, good.
The last topic is the unemployment insurance fraud. And the revised evaluation question is just a slight tweak to have it be focused more on workers' eligibility rather than a specific claim. So again, I don't think it's a substantive change. It's just refining it a little.
Mhm. Is everybody okay with the revised form then? Okay, I'm seeing nods and, okay, we're good with that. Have we gotten through them all then, Ms. Randall? Okay.
Madam Chair, yes, we have. Thank you.
Okay,
Madam Chair.
members, we've had that discussion on those questions and Mr. Nobles, and then I'll call on you, Representative Hansen.
I just want to go
Mr.
back
Nobles.
to another question that Representative Liebling raised, because I think the impression was left that we are putting out 10 that we ultimately will
Do all 10.
conduct. And I just want to be clear that, and Ms. Randall maybe has in mind the number, and I know it's always hard to know exactly how many we can handle because it partly depends on the size, the scope, and everything. But we are not prepared with the staffing level we have to do 10. So there is a next step in your process that will have to narrow this down further.
Right. That's an important reminder, Mr. Nobles. By the time we go through this, we get quite attached to them, but that's the 6 of us, and there are another 205 members. No, let's see, 195 members left. Get my math straight here, to vote on this. So our job is to do as best we can to reflect our members. With that, a reminder, what I'd like to do is have a motion to put forward these 10, and these go to the Legislative Audit Commission, the full commission, for them to hopefully ratify our choices and our recommendations, which most of the time they do, but that will happen next. And then after that,
Madam
we'll
Chair.
go into the process. Yes,
Okay.
Ms. Randall.
Sorry, I just wanted to maybe walk through the process quickly. So,
Well, let's take the motion
Okay.
first and then do process.
okay.
Representative Hansen.
Thank you, Madam Chair. And I think that the motion is that to send the 10 out to the 201 and then come back and pick the whatever, and then that goes to the full commission, but I may be wrong on that. I would move the 10 as revised.
Okay. On that motion, members, all those in favor say aye, raise your hand.
Aye. Aye.
Okay, motion prevails and is adopted. Thank you very much, members. It takes a lot of work, and I really appreciate your thoughtful time. It's really important. So, Ms. Randall, would you walk us then, and thank you, Representative Hansen, for making that motion in such a way that Ms. Randall can now let us know the next steps. Thank you.
Thank you, Madam Chair and members. The process is as Representative Hansen reflected. So we will now put a survey out to all members with these 10 topics. You know, we used to do a paper survey. That's not going to fly this year. So I think what we'll probably do is just send it by email and just ask people to respond by email. I think we did that last year when we were pivoting, and that seemed to work pretty well. So we will send an email out to all members either later today or tomorrow morning, saying here are the 10 topics. And one nice thing by doing it electronically, honestly, is that we can then link the background paper to each of the topics as well. So if members want to know more about what the topic they're voting for, they'll have it. If they don't want to know more, they don't have to click. So I think that'll work for members. We'll give them, I'm thinking through the end of next week. I know you've got busy conference committee times. There's a lot happening. So I think we'll give members through next Friday to respond to the survey. And then the subcommittee will meet one more time the following week to review the survey results. PED staff or OLA staff will also have developed a ranking of the most promising to the least promising, where we think we can add the most value. And then you all will select the final 5 topics. That is the number we're going for this year, 5. And you know, you've taken all the information. It's not merely a winner takes all type of process. But of course, the survey votes are important. And then once the subcommittee selects those final 5, then it goes to the full commission for final approval. And sometimes those meetings happen back to back, and sometimes there's a couple days between the meetings. It all will depend on member schedules. And of course, by then we're into June, and maybe you'll all be back for a special session then. I guess, we're all just learning to be flexible. So that's the remaining process, Madam Chair.
Thank you, Ms. Randall. When you send out that list that we've done, again, that's great. But would you also include with that, for us, for our members, of topic selection, that proposed or that way of going, the date of May 28th, and then the process? We don't have dates yet, but at least we'll all then understand. Not muck it up like I just did. So thank you, Representative Hansen.
And
With
Madam
that,
Chair-
members,
Madam Chair.
Representative Liebling
Chair.
or Mr. Nobles.
I just wanted to-
Representative Liebling?
Go ahead, Representative Liebling.
All right,
Representative-
thank you, Madam Chair. I just wanted to confirm that when this goes out to members, we just are sending out the revised evaluation questions and the change title, and not confusing people with what we have. So you'll have to do a little rewriting before you send it out, I assume. Just wanted to confirm
Ms.
that.
Randall?
Madam Chair, Representative Liebling, yes, that's a great point. I will be removing the revised evaluation question line from the background paper, and I will get rid of original evaluate. So it'll just say evaluation questions, and the title will be changed to reflect whatever members agreed on here today. Yeah, thank you for that.
Thank you, Ms. Randall. I appreciate that question, Representative Liebling. And now you, Mr. Nobles.
Well, Madam Chair, I just wanted to take an opportunity to thank you, first of all, for your work chairing this committee, subcommittee, after a lot of work you do chairing the state government finance, but I especially want to thank you for pulling into your mini policy omnibus bill the housekeeping language that the Legislative Audit Commission had approved. We really appreciate that. I know you had a lot of other things to accomplish, but the fact that you kept that in mind and did that for us is very much appreciated. And I know many other people helped you, but you were sort of in the vanguard of it. So
thank you for that, Mr. Nobles, but absolutely it's a team effort of all the legislators and all the staff. The more you're around this facility, the more you appreciate what our staff do and how incredibly valuable that is. And I know they work as a team also, as Ms. Randall has commented. So we appreciate that very much. But I've always had a special heart for the work of the Legislative Audit Commission. And so it helps to have that. Well, members, again, thank you. I think we've had a good meeting and I think served our House and Senate members as well. And if there's anything else, otherwise I would adjourn. I know we've all got full days ahead of us yet. All right. Well, again, thank you all. We will be in touch. See you again. Thank you so much.
Thank you.